to be here to contribute little towards health awareness, especially in education for young girls and boys, which is the need of the hour. To start with, Dr. Desham is a medical doctor by education and a public health analyst by passion. She brings her academic excellence for solving community grassroots problems. She specializes in epidemiology and occupational health and is in vision of a healthy India and a happy India, which is in alignment of our vision too. True to her name Desham, she wishes to strengthen the country and the countryside by bringing innovations in healthcare systems. And most importantly, she is a good friend of mine. We had worked together in Usmania, and I really thank and appreciate her for giving her time on short notice and giving all her valuable sources. Thank you very much, Dr. Isha, and over to you, Dr. Desha.
Thank you, sir. Thank you.
Thank you very much for that introduction, Dr. Aleem. I wish and I hope that I live to your expectations. And then, as we have very less time today, we have around 20 to 25 minutes. I would not like to waste any time, but would like to introduce very briefly about HIV/AIDS, which I think is necessary that every student and every adolescent or every young adult should know about HIV/AIDS. Why are we so much worried about HIV/AIDS? And in these recent COVID times, there is much more danger ahead in front of us. That is coronavirus disease, but still we are bothered with HIV/AIDS, right? So first of all, I think you all have some basic knowledge regarding HIV, regarding AIDS. It is AIDS, as the Dr. Ayesha Begum Madam has told, that the full form of AIDS is all in acquired immunodeficiency syndrome. It is called as an acquired because later in the course of your life you will face some immunodeficiency symptoms, and hence it is called as acquired immunodeficiency syndrome, which is caused by a virus. Just like coronavirus, AIDS is also caused by virus. So this is caused by human immunodeficiency virus, and again there are types in HIV virus, and we need not know all about HIV virus as such, but just remember that it is a virus that causes us AIDS. And we have seen many people stigmatizing COVID patients, right? Like, if someone is affected with corona disease, they are stigmatized. People are, afraid to talk to them, or people are afraid to keep them as tenants in their house. They've been evicted, because they are affected from COVID. In the starting months of COVID, in April, May, June, July, and till now it's continuing. The doctors are not able to get rent anywhere because of that stigma for the COVID. Until recent times, before COVID, the most stigmatized disease was HIV/AIDS, as well as along with the HIV/AIDS, we have other disease called as leprosy, but we have almost forgotten about leprosy right now. HIV/AIDS has become a more complicated disease in the times of COVID, because we are not able to test enough of HIV patients. Okay. So why is this HIV stigmatized so much? This is because it was discovered very recently. Before 30-40 years, we have discovered this virus, that this virus is there and we can get certain diseases with this virus. There is no cure for this disease. No. There were many kind of misconceptions hanging around this HIV virus, that once you get a HIV virus, you'll be a very dangerous person, and there are a lot kinds of misconceptions around HIV. So that is why people are stigmatized with this disease. Okay, but to be frank, there is nothing to be worried of HIV, because once a person acquires HIV, it takes around 10 to 20 years of time to manifest the symptoms. I hope you're understanding my words. Manifesting the symptoms means once if I get coronavirus, it will take 2 or 3 days for me to develop the symptoms. That is, I should get running nose, I should get sore throat, I should get cough, I should get fever. This 2 to 3 days time I will take in for developing the symptoms. Whereas in HIV/AIDS, this duration is very long. Like it almost takes 10 years to 15 years for a healthy person to manifest the symptoms. Okay, till that time the person looks very normal, and he or she doesn't have any symptoms, just for a mild cold and fever and cough. Except for this, generally a person does not have very big symptoms of HIV/AIDS until 10 to 15 years of life. Okay, so we have to break whatever misconceptions we have regarding this HIV/AIDS. Okay, Dr. Aisha, please can you let me share my screen so that I can share some few slides which I've prepared in the very less time since morning.
Okay, madam. I am trying to share screen. I should make host to you. After that,
you
please,
can just
you make me
enable the
host.
participant screening. Okay.
Yeah,
Okay,
please join to participants. Admit them. After I am making host you.
Okay, fine.
Okay, madam.
Okay.
Okay. Thank you. Now you are a host. You are the host.
Yeah. So, with a very less time given, please excuse me if the slides are very bad. I wish I could have made the better slides. Are you able to see my screen, Dr.
Yeah,
Aisha?
madam. We are seeing.
Okay, fine. Yeah. So, 2017 World AIDS Day theme was, right to health and right to know your status. So this year's status theme of HIV/AIDS is ending the HIV/AIDS epidemic and resilience and impact. This means that the coronavirus situation, which the world is affected right now, is making us, detect less number of HIV/AIDS cases. So that is why this year's theme is like resilience and impact, and global solidarity, where each and every country should participate in increasing the testing of HIV/AIDS. So why are we more concerned about HIV/AIDS? Is like 33 millions of lives are lost so far from the time the disease is discovered. Like 33 million. These 33 million lives are lost. And then 38 million people living with HIV at the end of 2019. And then 15 lakh deaths until now we have seen in coronavirus from December 2019 until now. And because of HIV, we are seeing 7 lakh deaths every year. So you can imagine the amount of burden we have due to HIV. See, almost half of the deaths which we are having, almost half of the deaths which we are having due to coronavirus are due to HIV, and then that is occurring every year, right? So this is why we need to worry. And the signs and symptoms are like, as I told, that there will not be any signs and symptoms once you get HIV. It will be like, there are no symptoms, or influenza-like illness. You can see just like a fever, headache, rash, sore throat, just like coronavirus, you'll have this kind of symptoms. And then you'll become normal again for almost 10 to 20 years. And then again, suddenly you will have this weakening of immune system, and then you'll have swollen lymph nodes. Lymph nodes we have for fighting any kind of infection in our body. So we have here under the neck and in our axilla and in our body, you will get small swellings. And then there is weight loss, almost 10 to 20 kgs of weight is lost, and then fever, diarrhea, cough. So this HIV can also occur along with tuberculosis. So how is it transmitted from person to person? Most of us know that the transmission is by sexual transmission, but then there are also other types of transmissions. Okay, there is like through breast milk it can get transmitted from mother to child, or else if you are having a blood transfusion, if you end up in an emergency and you want blood, if the person who is donating the blood has HIV, you might also get HIV. And then even if you have a prick of hand prick, this is most commonly in doctors and nurses. If he or she gets a prick when she attends a patient, then she might also get HIV, but it is very rare. Okay. And the most important thing that we all should know is individuals cannot become affected ordinarily day to day by kissing, hugging, shaking hands, or sharing personal objects, sharing food, sharing water. By these kind of things we do not get HIV. This is most important to remember, because when we see patients in our OPD, the patients will be more stigmatized, they'll be more lean, more weak, even mentally as well as physically, because no one in the society gives them that confidence or gives them that love they deserve. So it is not their fault that they have HIV or AIDS. They might have become infected accidentally. So we have to be very, very compassionate towards the individuals who have HIV and AIDS. I'll tell you a story. When I was in our OPD, I have seen a patient coming, walking in, and then suddenly our compounder
मैडम
have.
अस्सलाम वालेकुम। आयशा मैडम।
हाँ, वालेकुम अस्सलाम। आप लोग मीटिंग में रहिए, मगर म्यूट करके रहिए, बात मत करिए प्लीज।
मैडम बच्चे आ रहे हैं, ऐड नहीं कर रहे मैडम, बच्चे ज्वाइन हो रहे हैं लेकिन ऐड नहीं हो रहे।
ऐड होते मैडम, ऐड करते प्लीज। वेट
जरा बोलो।
हाँ, थैंक यू। ओके, प्लीज मैडम ऐड देम।
Okay,
they are joining, madam, please. Yeah, thank you, madam. Sorry for disturbance. Continue your.
No problem. So, yeah, I'm sorry for not letting in. This is a very new this thing for me, that letting in and all. Okay. So when I was sitting in OPD, I have seen a patient, a young lady of around 30 years of age. She was very lean and just came to OPD, and a compounder have stepped in, and he was saying that give her of paracetamol, and he gave her paracetamol, and then he has behaved with her in a specific way, and he told her to leave immediately. I did not understand what was happening, and I was shocked to see such kind of behavior. And I asked them, like, what's happening here? Why are you sending her off without having, she did not talk to me, or I did not talk to her, you are just sending her off. And then he was saying that, madam, she is AIDS patient. We should be very careful with AIDS patient. We need not talk with her. You just give paracetamol and you send her off. She will just come like that. So this kind of behavior we are seeing even with the health personnel. So it is very important for us to be, to know about the disease, that the disease won't transmit if you see the patient, or if you touch the patient, or if you record her BP, or if you hug her, or if you share your food with her. You'll not get that disease. So when I did a survey on this, in intermediate going students, almost all of them, told that the disease spreads by kissing or hugging. This kind of misinformation that the people have is misinformation that the people have. We have to break this misinformation, and we have to break this stigma that the people have about HIV/AIDS. Okay. So how is this disease transmitted? Like who are at risk? So most of the people who are at risk are people who are having unprotected anal or vaginal sex. That means unprotected sex means what? Without using a condom. If you are going to have sex with any woman or man without having a condom, then you might get this disease. And then if you are having another sexually transmitted infections like syphilis, herpes, sexually transmitted infections other than HIV/AIDS, there are many other sexually transmitted infections. So if you are having one sexually transmitted infection, then you might get AIDS. You have more risk of getting AIDS. And you all know that if you are drug abusing, like if you are sharing contaminated needles, syringes and all, then also you might get HIV/AIDS. And receiving unsafe injections, blood transfusions and all. And then accidental needle stick injuries, as I told that nurses and doctors, while they're performing surgeries or when they're dressing the patients, they might also get infected. So these are the kinds, these are 4 or 5 types by which the HIV/AIDS is transmitted. So how is it diagnosed? When a patient comes to us, then we do a rapid diagnostic test, just like coronavirus. We take a blood sample and then we put it in a slide and then we see if it is positive or negative. So in this AIDS, the most important thing we have to remember is like there is a kind of window period. If you are infected by HIV/AIDS, if you are having sex, or if you are having blood transfusion today of HIV infected blood, then body needs at least 28 days to develop antibodies against this HIV virus. And then during this 28 days, if we test, then it will not be positive. This is called as window period. So once you have a doubt that you might have HIV or AIDS, from this day, you need to wait for at least 1 month, and then you have to get tested. Then your test will be accurate. Otherwise, there might be false negative. Okay. So I think you're getting my point, that if you are in a doubt today that you might have HIV, you need to at least wait for 28 days to get tested, so that your testing will not be affected. You'll not get false positive or false negative if you wait for this period. So testing services we have everywhere in our state, even around the country. We have almost around 30,000 testing centers. These are called as ICTC centers. You can go to any government hospital, district hospital, public, primary health center, or you might go to any medical college and get yourself tested. Okay. You'll get the results on the same day itself. So whenever you go to testing, you'll be asked for your consent. Without your consent, no one should test you for HIV or AIDS. Even a doctor does not have a permission to test you for HIV/AIDS. Okay, unless you give permission, we won't have that thing. So informed consent and confidentiality. If you know of any person who have HIV/AIDS, you should not tell everyone else in the society, going on telling that this person has AIDS, this person has HIV, we should be away from him. That should not be done. Confidentiality should be maintained by the doctor, as well as the patient, as well as the patient's relatives, whoever have known the status of that patient. Maintaining confidentiality gives them confidence in the society, and then they will also live responsibly, not transmitting infections to others, and using condoms, or using safe injection practices. They will do all this only if they are given sufficient respect in the society. Okay. So how to prevent this sexually transmitted disease? So we have to use condom every time, and then you have to get tested and you have to be counseled for it. And then there is a voluntary medical male circumcision. This is recently developed strategy by WHO, where circumcision of males of around 15 years of age will reduce the risk of transmission of HIV, because there will be less sexually transmitted diseases and hence less risk of getting HIV also. And then even for preventing the disease, we can use antiretroviral drugs, meaning if the wife has a disease or if the husband has the disease, to prevent contact to his wife, the wife can take medicines even before she is diagnosed of HIV. Then she will have less risk of getting HIV. Okay. Treatment, we have no cure for HIV, but then we can reduce the viral load a lot by using antiretroviral drugs. Okay, so you have to go to a doctor, you have to test yourself, you have to get 3 drugs which are very important in the treatment of HIV, that is called as antiretroviral drugs. You will be given 3 drugs and you have to use it for lifelong, so that you'll not transmit it to your loving partner, or you'll not transmit it to your children. So this is very essential. Even if you're not cured of the disease, your viral load will a lot reduce due to treatment, and hence you cannot transmit the disease to others if you are treating. So what kind of policy changes we need for HIV? Already we have section 377 in our India, where they have decriminalized the practice of homosexuality, right? So decriminalization brings down, the stigma of the people. If already some people are homosexuals, or if already some people are working, there are sex workers or there are drug abusers, there will be gender identity problems. Some people will recognize themselves as transgenders, or some people will recognize themselves as homosexuals. There should not be any kind of shame on such people, because it's their biological preference, and we should not discriminate against them, and we should protect them against discrimination. Anti-discriminative and their protective laws should be addressed, and then all kinds of services should be available to people. For transgenders, there is no such hospital designated for transgenders, so you can understand how much the disease will be there in transgenders. They will be at risk of all kinds of diseases, and they will not get treatment. Even if they come to hospital, everyone will be seeing as if they have done some mistake, or as if they have committed some crime. So if they are in such a situation, they will not go to a doctor, and they will not seek treatment, and then those people will spread infection to others. So it is very important that key populations, whoever are key populations, that is the prostitutes or sexual workers, and then the transgenders, and then the truck drivers, whoever are at more risk of getting the disease, IV drug abusers. Some people take IV drugs like cocaine or morphine. They inject themselves, so they should not be discriminated. They should be provided health services, and we should counsel them. The community should give strength to them and tell them that there is treatment available for HIV. If you take medicines for lifelong, you will not be able to transmit to others. Okay. And then we have to provide them strength like this. And if you know of anyone who have HIV or AIDS, please talk to them, and then give them confidence, give them strength that you are available to them at any moment, and then they can take medicines, and they should get their family also tested for HIV, so that they can take the drugs. So be safe, always use condoms for any form of sex to prevent HIV or other sexually transmitted infections. Look after your sexual health. This is very important. Either you are a black person or a white person or a male or a female, nothing matters. Just use condom whenever you are having sex. And love safe, love is very important. You have to love others, but then you also have to save them from having any kinds of diseases. So protect yourself and also your partner from having sexually transmitted diseases. If your virus is undetectable in the blood, then it means that you are not transmitting infection to the other person. So if you are taking treatment for HIV, even if you are HIV infected, but you are taking treatment, then you cannot give the disease to other person. So this is very important, that if the virus is undetectable in you, then it is untransmittable. Next is pre-exposure prophylaxis with condoms. This means that even if I don't have the disease, if my partner has the disease, if I take the medicines, then I won't get the disease. Okay. So even if my partner has the disease, I have to take the medicines, because I should not get the disease, or my children should not get the disease. So this is called as pre-exposure prophylaxis, and also use of condoms. Remember to use condoms for any form of sex to prevent HIV and other sexually transmitted infections. Early diagnosis and testing can help. This is the mother and child. These are the people who need our services exclusively. So you have to provide timely treatment and care to those who need it. We'll reduce HIV infections through that. We will save little children from getting HIV by testing the pregnant women for HIV. Okay, and we can also reduce the AIDS related deaths. thank you very much for listening to this. Be safe and always please you can ask any questions if you have.
Thank you so much,
very
madam.
much,
Hello.
Dr. Aisha, for giving me this opportunity.
Yeah, ma'am. Thank you, madam. Now, madam.
Audience, any queries? Any
Yeah,
questions? Please ask.
sir, please. Principal madam is joined.
Okay.
She is. Her name is appearing here. Madam, good afternoon, madam. I am heartily welcome to Dr. Chandra Mukharji, madam, NSS Chairperson and Principal, Government Degree College Zaheerabad. Madam, good afternoon, madam. I request our dynamic principal. Yeah, I request our dynamic principal, madam, to address the webinar.
Yeah, first of all, a warm welcome to the chief guest of today's webinar, Dr. Desham. Madam, you were totally, excellent in telling everything right from the scrap till the measures and the precautions and the treatment and everything. And we are really very much glad to have you, and we feel the privilege and proud to have you today in our webinar. And you have actually told us everything, and I hope our students, they must have been enlightened a lot by your lecture. And secondly, I would like to welcome our honorable guest of today's webinar. Aisha, give me the name, Dr.
Desham Chelimela, madam. Dr. Desham Chelimela.
दूसरे डॉक्टर जो है
Dr. Aleem sir.
Yeah, Dr. Aleem. Yes, our honorable guest of today's webinar is Dr. Aleem. Yes. It is only because of Dr. Aleem that we came to know Dr. Desham. Yeah, so I would extend my warm welcome to Dr. Aleem also. That you have given us such a good doctor, and we were all very much, enlightened about this AIDS, and I think it's a privilege on behalf of Government Degree College Zaheerabad. I thank cordially both the doctors, and also I would like to congratulate the NSS units for arranging such a nice program, especially Dr. Aisha Begum, who's very enthusiastic and excited, and she does all sorts of nice programs to our college. So I heartfully congratulate the NSS units 1, 2, and 3 with special mention to Dr. Aisha Begum. And I think I will give the platform to the participants. Whoever has any queries, you can just go along, because you will never get such a doctor who is so pleasing, and she can tell you, I mean, all your queries, whatever you have, she's there to explain for you. So please don't hesitate, students. Please go ahead and ask anything. Wherever you have any doubt, you can just clarify your doubts with the doctors. I once again thank wholeheartedly both the doctors, Dr. Desham and Dr.
Desham. Thank you, Dr. Chandra Mukharji, as well as thank you, Dr. Aisha. Thank you, Dr. Aleem, for giving me this opportunity. I really appreciate this effort of Dr. Aisha in bringing up the students together and creating awareness on HIV/AIDS. I appreciate.
We are not anything, but Madam Principal, Madam, every day motivates her, motivates us. Because of her, we are doing this now. Like this.
I totally accept, and I agree with Dr. Desham that Aisha ma'am is really a very enthusiastic and a very nice faculty, and we're very proud of her that she is always, bent upon doing such nice programs to our college. So I heartfully congratulate Dr. Aisha Begum for doing this.
Thank you, thank you so much.
Dr.
Aleem, if you would like to add anything to my presentation, if I missed any points in telling, you might please add.
Yes, Dr. Aleem, you're most welcome. We are actually looking forward to your discourse also. Please go ahead, Dr. Aleem.
And
Alim sir,
one more point in the
please mute
meanwhile,
yourself.
I'd like to enforce is like most of the people will ask me that if mosquito bites a HIV/AIDS person and then bites a non-HIV/AIDS person, will we get the disease? So you need to know that you will not get HIV/AIDS through mosquito bites or any other bite as such. There
Okay.
is no evidence of transmission of this infection. Dr. Aleem, please.
I'm sorry. So at this note, I would be
Excuse
very
me, sir.
happy to add a.
Sir, excuse me, sir. If meeting is closing, then we can join same link, sir. With same link. We can join. Please, sir, continue, sir. Continue, sir.
So I would like to share here a very positive story because most of the times we hear about taboo, stigma around HIV. I am very proud to say that one of the principals in our Zaheerabad at Timris College has given me this example. In her school, a small girl was admitted in her hostel who was with HIV, and she was taken care of by the principal very well, and she took care that she did not inform anybody, including the staff, about her condition. And every time her tests were done, she took it as a serious matter to hide all the tests and take care of her. And she also gave her lots of good nutrition, and she motivated always because one thing we need to understand, more than the physical thing, the mental stigma kills the HIV person. Now I am really proud to tell that the student has come up with flying covers, and she has joined in our own healthcare field, and she's working as a government nurse, and she's serving so many people. So the point what I want to drive home is people from HIV can live very normal lives like you and me if we leave the stigma apart. Like any other disease, it is a disease which can be totally taken care of. And like Dr. Desham has already told, if you are on ARV, when your viral load is less, then the transmission less is very less, and you can enjoy your normal life. And at the end, I would like to say my ABCs, which my professor in my microbiology always used to say about HIV. He used to say the three cardinal ABCs of HIV are: A, abstain from unprotected sex; B for be faithful to your partner; and C is use of condoms, and always be cheerful no matter what happens. Thank you very much.
Thank you, sir. Thank you so much. Now I invite to Dr. S. Ramlu, sir, to conclude the session. S. Ramlu.
Thank you so much, Dr. Aleem. Thank you very much. Where is Dr. Ramalu?
हाँ सर क्या बोलते हैं म्यूट करिए सर सर अनम्यूट करिए Thank you.